How's it going, guys? Past level question, pathology, histo, step 1, 7-year-old boy, 1 month history, generalized abdominal discomfort, fatigue, lost 5 pounds during this time, vitals are normal, deep palpation of the abdomen shows 2 centimeter mass left of umbilicus, biopsy the mass shown. Question 1 is the most likely explanation for the findings, so let's just hop through. Well, why don't we look at the histo first? So, very buzzy, easy image of the starry sky appearance for Burkitt lymphoma. So you have basophilic, which means purple/blue, the basophilic background of lymphomatous B cells. Okay, and then you've got more pale appearing larger cells. These are macrophages. And the USMLE wants you to know, it's asked on one of the forms, that these are known as tingible, not tangible, tingible body macrophages, and they have an arrow pointing to one of the macrophages, and the answer is apoptosis. So you need to know that these macrophages will mop up slash phagocytose some of the Burkitt lymphoma B cells that are undergoing apoptosis. Sounds a little weird. You say, well, it's a cancer, it's hyperproliferating, but there is still some turnover occurring. And so these are tingible body macrophages. They phagocytose B cells undergoing apoptosis. So I don't really know what to tell you. They want you to know that. So let's just hop through the answers here. Choice A, 814 translocation, wrong fucking answer with anti-apoptotic molecule, because the reason it's wrong is because choice B is the answer. Burkitt is an 814 translocation almost always with the c-MYC gene, which is a transcription factor. Okay, not dramatic. It's past level, as I said. So you do need to know, in contrast, that actually, before I even go to that, Burkitt lymphoma, students will often memorize it as African boy with a jaw lesion, but you need to know that it can be intra-abdominal. I've seen it on one of the 2CK forms, coincidentally, where they give you an intra-abdominal lymphoma, and it's Burkitt, okay, causing a chylous accumulation. Chylous means lymph fluid, so chylous accumulation within the peritoneal cavity in that question. But you need to know it can be intra-abdominal or of the jaw. So follicular lymphoma, in contrast, 1418 translocation, is going to be anti-apoptotic molecule with BCL2. Okay, so BCL2, anti-apoptotic molecule, follicular lymphoma, they might tell you that there's a waxing, waning, painless neck mass over 1 to 2 years. That's how follicular lymphoma can present. It's the most common indolent, which means lazy, non-Hodgkin lymphoma. Okay, so these are all Burkitt and follicular and non-Hodgkin lymphomas. Lengthy discussion. Okay, Hodgkin obviously are Reed-Sternberg cells. All right, so let's just hop to the final ones here. 1517 translocation, wrong fucking answers. These are going to be APL, acute promyelocytic leukemia, aka AML type M3, and that's actually going to be a fusion protein, PML, RAR, alpha gene, okay? They're not obsessed with the translocation. Highest yield point is that you're going to see a smear. We have our rods, okay? You need to know all trans retinoic acid can be a treatment for APL as well as just regular AML, okay? And then finally, 922 translocation, wrong fucking answer. This is going to be fusion protein with Philadelphia chromosome, BCR-ABL. This is CML, okay, chronic myelogenous leukemia, one of the highest yield conditions on USMLE. So BCR-ABL, it's a fusion protein. That can be the answer. It can also be, as the answer, oncogenic tyrosine kinase. Okay, they want you to know that. It's a lengthy discussion regarding all these pathologies. Point is, wrong fucking answer. You know the deal. I'm to make more content like my stuff, subscribe my channel. Appreciate your time. That's it.